Okay.
6, as a matter of fact. All right, we want to bring in our first guest this morning. Does your child have trouble making friends? Do they have a habit they can't seem to break? Counseling could be a solution for you, and here to help you decide when to seek therapy for your child is child psychologist Dr. Cynthia Arnold.
Always good to see you.
Nice to have you back.
Beautiful new set, by the way.
And thank you very much. We love our new digs. It's nice and cozy.
It is nice.
I guess for this mother who they gave birth to triplets, they're going to face this one day. But every parent at some point looks at the child and says, we need professional help. It's not, but it's not always true. But in some cases, what should parents really be looking for if they're thinking seriously about counseling?
I'm going to give you a long list, but there's really two big ones, the two main ones to watch out for. Kids tend to not show depression or anxiety as much. They become irritable. That is your child's warning sign.
They lash out.
They become just the irritable, not kind of knowing what to do with themselves, irritable with friends, irritable at home. Irritability is the primary symptom for almost every mental health problem kids have.
And is that a irritability that is continuous, or is it incremental? In other words, you're irritable today, but tomorrow you're perfectly fine and happy?
It's
continuous?
continual, but it escalates over time until it's a behavioral issue, typically. But it's just the primary thing to watch out for is kids show irritability, not your prototypical advertisement of depression, anxiety. It's typically irritability. And the second biggest thing to watch out for are big changes in their lives, anything that's really different for them. So if your child already wasn't doing in school and is now not doing in school, that's not a big change. But if you had a B student who's now a D student, something major is happening. So it's big changes in their lives and irritability. Those are the two biggest things to watch out for.
Well, can you kind of see something coming before it happens? For instance, if you're going through a divorce, maybe you should think preemptively and get your child in counseling.
That's exactly right. Kids have a really hard change with adapting to new situations or big changes. So death, divorce, and relocating are really huge changes for a child. And it's kind of a misnomer to think that psychologists only work with kids with a diagnosed problem of anxiety or depression. There's a whole lot we can do to help kids transition so we have a healthy transition through, so you don't have all these long-term lingering issues. So yes, those are big issues. Another one is academic stuff. I've come here before and talked about learning problems. That's a big one we can get help for kids for. Not just in the treatment, but in how to understand what's going on so they don't get anxious, depressed, and sad. For a lot of kids, too, middle school years, adolescence, are a difficult time because academically they may be fine, but socially there's a lot of pressure. Is that a time to seek counseling? Possibly, and my answer to that is it depends on where you are as parents. If you know you weren't raised all that well and you don't have, I call it a rule book, a good rule book to teach your child, then it might be helpful to work with somebody who can help you solidify a really great rule book to teach your child. And by rule book, I mean how to interact with people socially, how to behave in class, how to do all these things, because a lot of folks had difficult upbringing and then mistakenly teach the same set of rules to their children, and then they have the same kinds of problems. So that sounds like it's more, that's where the parent would come in and really and get almost coaching. That's a really great point, because as a child psychologist, I always laugh that I see more adults than I see children, because unless it is helpful to the child to see me, then, let me back up, unless it's something that only I can teach the child, it's more helpful for me to work with the parents, because my parent is my best tool. If I teach a parent how to help a child, they see them all day, every day. I see maybe an hour a week. So what I do with most small children is to teach them, we call the problem something. Like kids who are angry, we call it an anger volcano, or people who have problems with depression, we may call it a control book for emotions, and we make a book together, and I'm teaching them very empirically validated strategies, but in a book form, so I can pull the parent in at the end and teach them, this is what we worked on, go over these points, Google these ideas. Like I had a child recently with really intensive anger, and so we called his anger a volcano. And when it builds up, it's the magma. When he overflows, it's the behavior, and there's a fault line where he can catch himself. And so his homework with the mom and dad was to go home and watch lots of videos of volcanoes, because now it's not him that has the problem. It's a volcano problem, and it's not so personal, so he can actually actively work on it, and he understands conceptually what's happening. So there's a lot of work we can teach parents to do for us and with us.
Should parents involve teachers? In other words, if, for instance, if there's going to be a big move, or if there's a divorce or a death, should you contact his teachers and say, just so you know, this is going on in our life, and if you're finding any problems, please let me know?
Yes, I actively work really hard to contact teachers as well as in my practice, but it is important for parents to know that insurance does not pay for time for professionals to contact teachers. So yes, I think parents should talk to their teachers. I do my best to keep an open email with teachers for that exact reason. Say, send me a line here or there as major things happen in school that I can work on with a child parent may not be aware of, all of these sorts of things. But it is really important to know that schools truly are not trained in this sort of thing about what to do, but in terms of informing them, absolutely.
All right, we talked about the long list of things. Let's just run through some of them.
Yeah.
You talked about, irritability and that big change that becomes constant and even more severe, but others, anxious, shy, withdrawn,
Yeah,
sad.
So let's talk about emotional stuff. In the world of psychology, we talk about internalizing behaviors and externalizing behaviors, and it's a great way to sort of understand what's happening. Girls tend to internalize, hold things in. Boys tend to externalize. Internalize are all of the things that we don't really do with our bodies outside so much. So internalizing is sad, shy, self-esteem. Externalizing is hitting, kicking, throwing, sort of spinning out of control. And due to our biology, boys tend to externalize first, girls tend to internalize first. And it's usually not a behavioral issue, it's an actual emotional issue that is shown in that way.
All right, good. We want folks to know, by the way, they can contact you. Dr. Cynthia Arnold, her number's on the screen, 503-274-0996. And, of course, we have information, too, on our website at KATU.com. Very good information. Thank you so much,
Dr.
Arnold.
Thank you.
When we come back, how aromas can really